To perform OR table repositioning with slide sheet, a minimum of 3 caregivers are required. Once lateral transfer is complete, the patient is laying on top of a single slide sheet folded in half. This slide sheet will be used for repositioning on the table. 2 caregivers, one on each side of the patient, grip the top part of the folded slide sheet, while standing next to the table with one foot in front of the other. A third caregiver supports the patient's lower extremities by lifting the patient's heels slightly off the table surface. On the count of 3, caregivers move the patient up or down on the table as needed. To reposition patient supine to lateral, cross the patient's ankles and place in position. One caregiver supports the patient by gripping near the shoulder and hip. The other caregiver grips the top part of the folded slide sheet and uses the weight transfer method to reposition the patient onto her side. To remove the slide sheet, pull down from the head and up from the bottom. Tuck the sheet under on one side while pulling through on the other. To return the patient to a supine position, take a single slide sheet and fold it in half twice. Tuck the folded slide sheet under the patient and push through to the other side. Once the slide sheet is in place, open the folded sheet by pulling up toward the patient's head and down toward the patient's bottom. Once the sheet is completely open, one caregiver pulls on the top part of the folded sheet while the other guides the patient by shoulder and hip. The patient is now transferred back to stretcher or bed. When working with smart slide sheets, never leave under an unattended patient. Never leave on an unattended chair or bed. Never place on the floor. Stow slide sheets safely when not in use.